Do you think your body belongs to you? Maybe not. Have you ever thought that some seemingly insignificant creatures may be quietly controlling your brain, eating your organs, and even changing your character? What's more terrifying is that you may not notice it. Next, I will take stock of 5 terrifying but common parasites for you, and uncover the true face of these terrifying parasites, and see how they sneak into your body and become the deadliest invisible killer in the human body. After reading it, you will re-examine every bite and every step of your life. Louis toxoplasmosis. This is a hidden killer that lurks in humans and animals. According to relevant medical research statistics, the infection rate of toxoplasmosis in the human population is about 30%. This parasite can infect mammals and birds all over the world, with cats as the ultimate host. But its true horror lies in its ability to quietly change the host's behavior. His life strategy is chilling. When he infects a mouse, the mouse will no longer be afraid, and the cat will even actively approach and be eaten. This biological manipulation technique allows Toxoplasma gondii to enter the cat body smoothly. In humans, studies have found that infection with Toxoplasma gondii may make people more adventurous, impulsive, and even associated with schizophrenia and anxiety. Toxoplasma gondii is mainly transmitted by feeding cooked meat, cat feces, or contaminated water, so when cleaning cat litter, avoid direct contact with meat and be sure to cook it, especially raw beef and lamb. And its incubation period may be as long as several decades. So when you feel that your decision is illogical, maybe it is really another one you are quietly manipulating. Split head and headache. It may not be stress, but a squirming parasite is eroding your nerves. Cleft head, also known as human crawling worm, is a terrifying parasite parasitic on the human body. Its infection route is extremely cunning, and cooked snakes, frogs, and even contaminated water may bring its larvae. Once in the body, this parasite does not stay in the intestine honestly, but directly enters the blood system and reaches the brain. It can cause severe headaches, vomiting, epilepsy, and other symptoms, and even severe nervous system damage. Headhunting has another terrifying feature. It can live in the human body for more than 10 years. In rare cases, headhunters even grow into adults in the patient's body, reaching a few centimeters long. Imagine that a parasite is slowly squirming in the depths of your mind. This kind of picture is enough to make people shudder. So be sure to cook frog and snake food thoroughly, and do not drink raw water. This is not a question of eating habits, but a warning of life safety. Third, the slow-moving head-hunting ferret takes a sip of the cool stream water, which may be exchanged for an eyeball killer that has been lurking for many years. Man-style head-hunting ferret is a parasite that can enter the human body by contaminating water sources and feeding cooked snake or frog meat. The horror of this parasite is that it likes to travel. After entering the human body, it will travel around under your skin, pass through muscles and organs, and may even reach the eyes and brain. Imagine a parasite slowly squirming in your eyeball, which will not only cause blurred vision, but may also lead to permanent blindness. What's more terrifying is that even the initial symptoms of headhunting and infection are extremely hidden, and they are usually misdiagnosed as other diseases. By the time the condition is serious, he may have caused irreversible damage to your organs. So remember an iron law: refuse raw water and put an end to life and death. Especially in the wild, these seemingly pure natural environments often hide the most dangerous killer for hookworm. Sometimes standing on wet land, there may be an invisible vampire under your feet. Hookworm is a miniature parasite that invades the human body through bare skin. Especially like humid and warm environments, such as rural soil, grassland, or polluted water sources. After touching the skin, its larvae will quickly penetrate into the blood, then travel with your blood flow, reach the lungs, and finally stop in the intestines to start his blood-sucking career. Hookworm is a greedy vampire. A hookworm can suck about 1 milliliter of blood a day. If it is a severe infection, the patient may experience severe anemia, malnutrition, and even heart failure. You may feel tired, weak, or even think it is simple anemia, but in fact hundreds of little vampires are devouring your vitality. In order to prevent hookworm disease, it is recommended to walk in shoes, avoid direct contact with potentially contaminated soil, and strengthen personal hygiene. 5. Roundworms. Imagine that there is a 30-centimeter long neighbor living in your stomach. Does it feel numb on the scalp? Roundworms are one of the most common and stubborn intestinal parasites, especially susceptible to infecting children. The eggs of roundworms enter the human body through contaminated food or water, and hatch into larvae after being baptized by stomach acid, but his travel plans are not over yet. The larvae enter the blood system, are taken to the lungs, and then return to the intestines with coughing, and eventually develop into adults. An adult roundworm can reach 30 centimeters in length and can even clog the intestines. Roundworm infections usually cause abdominal pain, vomiting, and malnutrition, while severe infections can cause intestinal obstruction and even death. In some extreme and terrifying cases, echinoscopes try to get out of the nasal cavity or mouth of the human body. Such a terrifying scene seems to come from a horror movie. However, in areas with high incidence of roundworm infections, it is an unquestionably cruel reality. The key to preventing roundworms lies in good hygiene. So the horror of parasites lies not only in their harmfulness, but also in their concealment and imperceptibility. It is not difficult to guard against these parasites. Hygiene habits, clean eating, and awareness of prevention are our strongest weapons.